congratulations on your baby.
Hi, thank you.
How are you feeling?
I'm feeling okay right now.
That's good. Well, my name is Rocio. I'm be your student nurse. I'm gonna be doing a physical assessment on you. Is right now a good time? Okay, is it okay if I put your baby on her bed?
Yep.
Okay. Okay, so I'm going to start off your assessment with taking a set of vital signs. Is that okay? So I'm just gonna put the blood pressure cuff on you, do your pulse ox, and then take your temperature. And can I see your wrist just to take your pulse? Okay, very good. Can I just take off your pulse ox? It's okay. Let me take your temperature thing. Okay, you're 98.6. And can I take off the blood pressure cuff? Everything is okay with your vital signs within normal limits. Are you feeling any pain right now?
No pain right now.
No pain, okay. And do you have help at home with your baby?
Yes, my husband and my mom are helping me.
Okay, and is this your first pregnancy?
It is.
Okay, good. And what's your occupation right now?
I'm going to school right now.
Going to school, that's good. Okay. Do you have any like feelings of sadness or like happiness all of a sudden, kind of like mood swings?
I'd say just right after I gave birth, it was really emotional in general, but I'm feeling okay right now.
Okay. And have you ever had like just started crying randomly?
Last night I did once, but just it was happy tears. It was just
Okay.
feeling like happy about like everything going good and stuff.
That's good. And have you had any like feelings of anxiousness or like maybe stress?
A little stress, just kind of getting used to everything, but I feel good.
Okay, that's good. Well, this is a little normal just because there is a lot of hormones in your body due to the pregnancy. The symptoms should be subsiding maybe in 2 weeks. If they last longer than 2 weeks, you would want to see your healthcare provider just because it might be postpartum depression. Right now, don't worry too much about it. You seem to be doing fine. So, but just letting you know, just in case.
Okay.
So I'm gonna start taking a look at your breast. Are you comfortable right now? And is it okay if I touch your breast and everything?
Yeah.
Okay. And have you been breastfeeding?
Yes, I have.
You have? Is it exclusively breastfeeding?
Yes, exclusively breastfeeding.
Okay, that's good. And have you had any like soreness or anything going on with your
No
breast?
soreness.
What about cracked nipples?
No, I have not noticed them for that.
Okay. And you said no pain, correct?
No pain.
Okay. So, has anyone ever talked to you about the benefits of breastfeeding?
Just very briefly.
Okay, so just like a quick little summary, just because you said you are breastfeeding. Breastfeeding is good for you just because it decreases the risk of breast and ovarian cancer. It can also help your bleeding stop a lot more quickly than if you don't breastfeed. It can help you put off the weight that you put on during the pregnancy, and it's just a good way for you to have that interaction and with the newborn since you're breastfeeding. And for your baby, it actually decreases the risk of SIDS. It decreases the risk of ear infections and maybe even some stomach problems that your baby can have in the future.
Okay.
And you did say that you haven't had any cracked or sore nipples, correct?
No.
Okay. Well, since you are breastfeeding, this can happen. So if it does, ways to help the symptoms and just help it heal a lot more quickly is you can express some breast milk on it. So kind of how I was examining you, you put your hand in a C and you like grasp your breast and you squeeze and you just spread it around your nipple. And because breast milk has a lot of immunoglobulins, it has antibodies that can help with healing and make it feel better. You can also try ointments, or you can try a gel pad. And the gel pad just decreases the friction between your bra and or like any other clothing you have and your nipple. I just recommend not to use the ointment and the gel pad at the same time because it can actually clog up your milk ducts and it becomes really painful and it can be a lot more difficult for you to breastfeed your baby.
Okay.
So have you used the bathroom recently?
Yes, before you came in.
Okay, that's good. So I am going to be looking at your stomach, or your bladder and your uterus. So I'm just going to move this. Is this okay with you?
Yeah.
Do you still feel comfortable? Okay, so let me know if you feel any like pain or just discomfort when I do this. So I am going to be feeling for your uterus. It should be going down maybe feed her breast every day. It does feel hard right now, which is good. It means that it's going back to its pre-pregnancy state. If it would have felt a little like squishy or something, it would have meant you can be at a higher risk for hemorrhaging, but you are okay right now. So I'm just going to be listening to your bowel sounds real quickly.
Okay.
It might feel a little cold, so just bear with me.
Okay.
Okay. So, have you been using the restroom frequently? Like, have you been peeing?
I just like the normal, like I was before.
Okay, so can you like describe maybe like how the urine looks? Like, is it yellow? Is it clear?
It's clear.
It's clear. Okay. And there's no like, it doesn't hurt when you urinate or anything like that.
No, nothing like that.
Okay. And how about like once you finish using the restroom, do you tend to like maybe drip a little bit or anything?
No, I haven't noticed that.
Okay, that's good. And how about your bowel movements? Have you been going regularly?
Just like once a day.
Once a day, and is that normal for you?
Yeah.
Yeah. Okay, so everything seems okay. What about bleeding? Have you been bleeding recently?
Yes, I have.
Okay, and what's the color of it?
It's red.
It's red. And do you know about how much? Is it a lot? Is it a little?
Not like a lot, not excessively, just like a little bit.
Okay. And you are 2 days after you give birth, right?
Yes.
It's been 2 days? Okay. So you are bleeding red, which that is a little normal. It's called lochiorubra. It does happen maybe 3 or 4 days, or it stops 3 or 4 days after. After that, you might notice that it turns like clearish color, and that's called rubra serosa, or not rubra, sorry about that, lochia serosa. This can last up to 10 days. It's normal, and then it can turn into a whitish, yellowish color, and it's called lochia alba, and that can last up to 3 weeks. But since you did say that you were breastfeeding exclusively, or at least trying to, it can actually decrease the amount of time that you're bleeding.
Okay.
Yeah. Okay. So, did you tear when you gave birth, or you
Yes, I did.
Okay. So, how is it feeling right now? Is there any pain with it?
No pain.
Okay. Do you mind if I look real quick?
Sure.
Okay, can you turn real quick for me? I'm just gonna put my gloves on. Okay, so I'm just gonna be looking for redness, for any inflammation. I'm gonna be feeling if it's hot to touch. So I'm just gonna be looking also at your anus, making sure that there's no hemorrhoids or anything, and you seem to be fine. So you can turn around for me if you like. Okay, so just, has anyone gone over how to clean your perineal area because of your tear?
They explained briefly before.
So just to jog your memory real quickly, you can just remember to wash your hands before. You don't want to introduce any new germs to the area. And you could just take some like lukewarm water and clean it with that. And if there's any pain or anything, you can maybe try an ointment, or you can even ice it. Just try not to do it for more than 15 minutes at a time.
Okay.
Yeah, that's basically it. So can you actually sit up for me?
Yeah.
Okay. Have you been feeling any pain on your calves or anything?
No pain.
No. Okay. I'm just gonna take a quick look, make sure it's not hot or anything. Okay. Everything seems fine. Just looking at your skin, making sure there's no swelling or anything. Just gonna look at your arms real quick. Can I see your arm?
Yeah.
Just gonna turn it around. Okay. And then your face also seems to be okay. So I'm just gonna look at your reflexes real quick, so you can just relax. Try not to think about it. I know it might be a little difficult,
Okay.
but try your best. Did that tickle?
Yeah, I did. Sorry.
Okay. No, it's okay. Let's do the other one. Okay. Okay, so I think that's all I have. You can lay down if you want to. Do you want me to bring your baby to you?
Yeah.
Okay. any questions for me?
No questions right now.
When was the last time you breastfed actually?
About an hour ago.
Okay, so I was gonna ask if I can actually look at how your baby was latching, but since you just fed her, sorry, I'll come back later just to see if like if she's not latching properly, maybe help you or give tips about that.
Okay.
But for now, that's all I have to do. Do you need anything?
No.
No? Okay. Well, your call light is right over here. If you need anything, just let me know.
Okay. Thank you.